Hey guys, let me turn down my heat. So, I'm on my way home after working like all day. Night vlog. It's like, let me get by the lights so you guys can actually see me. But I don't know if you can see my scar or not. You will in a second. See? It's almost been 3 weeks. It's not that bad. Most people say, if I didn't point it out, they wouldn't notice. But see, I feel like that's kind of not true because I'm the type of person that will notice literally like everything. I'll notice if you have a mark on you. But then again, I'm a Virgo, so you know, it's kind of obvious. But I've been wearing a lot of like high collared shirts and stuff, so you know, maybe it's a little less noticeable because of that. I'm not ashamed of having this scar, but I don't think it looks good, you know? So, of course, I'm going to try to cover it. I don't really want to answer everyone's, like, you know, I work a lot with the public, so it's like I don't want to have to explain all the time why I have a scar. So anyways, let me update you on the latest. So, I told you guys that I have thyroid cancer, and it's multi-papillary carcinoma and something else. And it likes to go to nodules and be more dramatic, okay? It's like more dramatic. So, I have to start the is it 131 or I31 radioactive radiation. Now, here's the thing. I've done, it might not sound like it since I can't even, like, just remember right now I'm just kind of out of it, but I have time to film this, and I'm driving, and that's when I like to do these updates while I'm driving in my car. I have done, I think, a comfortable amount of research as to what the next protocol is and the next steps. So, because I have thyroid cancer, they have to do a radioactive iodine treatment. Now, I live in Illinois, about 35 miles outside Chicago, and I don't know if it's because of the whole like Obamacare, health insurance, but since health insurance has changed a lot over the course of the past few years, what hospitals deem necessary and what they cover has changed too. And like, what do I mean by that? Well, this is what I mean by it, you guys. So the radiation that I will be receiving is going to make me radioactive, where other people can be exposed, and pets and plants can be exposed from like secondhand radiation, if you will. So what they have done in the past is they put you in isolation between 3 to 7 days. I think the average amount of isolation for people is about 4 to 5, okay? Sorry, I look red because the person has their brakes on in front of me because I'm at a red light, so I'm gonna look a little red. Ooh, spooky. So, because of that, because they don't want you to be like contaminating people, they put you in like isolation, or they put you kind of like in segregation from the rest of like the general public, which makes sense because you don't want to expose radiation to people that don't need radiation, right? Just makes sense. So I was under the impression that I was going to be going into this isolation for the time that was declared that was necessary. I get a phone call. I got my blood done on Wednesday because they have to make sure that I have no hormones in my system, so that way the cancer doesn't, that way I have a better chance at getting rid of the cancer like the first time that I go through radiation. So I get my blood drawn, and you know, you guys, I don't know if it's like because I have my thyroid removed and my anxiety, it hasn't been as prevalent as it has been in the past, or maybe it's just because I am like just wanting this to be done and over with. Maybe it's just knowing the fact that I have cancer and I want to just like kick its ass, no matter how stupid that sounds. I just took the needle like a champ. Here's my arm, just do it. And here I am going to itch my nose. And you know what I say about itching your nose? It makes you look like you're shading and you're lying. I did have a couple tears roll down my cheeks. And it wasn't because I was scared of the needle. It wasn't because I was afraid, you know, of the blood draw itself. It's because I've been getting really emotional lately. Just been getting extremely emotional, thinking that this is real. It's just, you would think having the thyroidectomy, the total thyroidectomy with the lobes and everything else being removed, you would think that would be the time to be emotional, but it's now that it's been a few weeks, now is when I'm getting emotional. And I know it's probably caused because my hormones are leaving me and I'm not getting enough sleep, and there's just like a bunch of other, you know, other factors too, but it just seems more real. And radiation to me has always been more scary than a removal of the thyroid. And it's probably because it's poison in your system, and I feel like there isn't enough information out there that makes me feel comfortable knowing full well that I'm putting radioactive iodine, aka radiation, into my body. That just does not sit well with me mentally. But then again, you know, I gotta do what I have to do, and if that means this is how I'm going to defeat cancer, by all means, I'm going to do it. So here's what I was getting at earlier with the whole insurance and policies changing. So like I said before, when you get the radioactive iodine, because you are radioactive, hospitals would quarantine you into an isolation section, and you wouldn't like expose other patients, people, even like in China, in Korea, in Japan, practice this, okay? Not that, like, why wouldn't they? It's just, this is just standard, like, procedure. Google it, and you'll see that when you are dealing with, like, the nuclear medicines, that this is just kind of, like, protocol. Well, they told me, so I called, I got the phone call saying that as soon as I get another blood drawn, which they wanted me to do it today, but I work the weekend since Saturday. I didn't have time to go into my endo between the window of like 10 and noon because I was in Chicago. They said once I get my labs done proving that I'm not pregnant, Wednesday I start radiation, which is the day before Thanksgiving, which isn't a big deal to me, but it's just like, great, okay. And so I said, you know, how long will I be in quarantine or isolation for? And they go, oh, no, you're going to be outpatient. And I said, well, from everything that I've seen, I'm not trying to pretend that I'm Mrs. WebMD, and I'm not trying to, like, undermine your authority, but from everything I have read and researched, and like this is pretty serious, and they usually quarantine people. Is there a reason why they're not quarantining me? You know, is it like a lower dose? And it turns out, yeah, I'm having a lower dose of radiation, and that is because I've already had my entire thyroid removed with the head majority of the cancer. And so now there are still cancer cells within my body, but just to be on the safe side, like they don't need to like nuke me, and like they're not starting from scratch, if that makes sense. That's how they explained it to me. So I'm not getting as high of a dose of radiation, but from what I've researched, that amount would still constitute to me going into an isolation or quarantine of some sort. And my doctor says, well, the hospital no longer, even if you had like the highest amount of radioactive radiation, they send you home now. And he said, why? Is that because I'm like, I've, read peer revised journals. I have like, I speak Chinese, so and I understand it pretty well. And I've watched the way that China performs like this type of procedure. I've watched the way Korea does it. I've watched the way that Japan has done it. I try to be as educated as I can, and either I've missed something or I'm just, this is a new thing. So I asked him, I said, why? And the answer I received kind of blew my mind. They said, well, a lot of people can't afford to take off work. Well, I'm sorry, okay, so let me just finish here. A lot of people can't afford to take off work for the amount of time that they need for isolation. The other one was insurance companies don't want to pay for you to be in like solitary confinement, basically. They don't want to pay for you to be in quarantine, so they send you home because people can't afford to pay for that, what the hospital thinks or the insurance company thinks is not necessary. Now, I'm not sure if that's just for like people who have like insurance that like sucks or what, because like I have pretty good insurance and I've maxed out my deductible, and I'm pretty sure if that is something that was like medically necessary, like my insurance company would cover it. And if they didn't cover it, then I would fight it and I would figure something else out, because I'm not comfortable knowing that I'm radioactive and I'm going to be exposing my husband, 1, 2, my animals, 3, plants, 4, general public. So then they said, yeah, there's definitely like, a lot of people have that common fear of exposing other people to being radioactive. So we recommend, now this is the part that out of everything that I had heard pissed me the fuck off. So we recommend you to get a hotel. Stay there for a few days so that way you don't expose your husband, and if you have small children, and get a hotel and just like make yourself quarantined. I was like, say what? They're like, yeah, get a hotel. That's what the hospital would recommend to do, is get a hotel. I'm like, what crack pipe hospital would say this? Like, you're a crackhead for saying something like that. Especially, like, had it been, we found research in the past 20 years that really the amount of radiation that you emit from your body for the first 12 hours, we keep you in the hospital for 12 hours and monitor you, and then we've realized that after 12 hours, most people spew out most of the radioactive iodine, and your levels are fairly safe, where we are fully confident that you're not of danger to people. Had they said that, sure, I felt better. But they didn't say that. They said, we recommend you to get a hotel so that way you do not contaminate your spouse, children, your small children, animals, and so on and so forth. Okay, so that's even worse in my opinion. Like, my family loves me, and like, I know it would be very hard to keep them away. But if you're telling me to go check myself into a public hotel, get my radioactive ass on the towels and the showers and the bathroom and God knows what else, and then a 6-month-old, a 2-year-old, a 97-year-old, the maid who cleans the hotel is exposed, that's even worse. Those are unsuspecting victims of my negligence. Because I don't want to like expose my family. Like, this is gonna sound bad, but I would rather set my husband and animals somewhere than put me in a public place. You know what I'm saying? Like, that's fucked up. I'm not going to risk other people because I'm sick and I don't want to expose I'd rather expose my husband than a potential victim, an unsuspecting victim, because I'm afraid, at least my husband can make up his own mind and make his own choice if he wants to be at home or not. But the 6-month-old baby who is coming in for Thanksgiving to see her grandma and grandpa, or, the person who just is fighting leukemia who goes into my hotel room afterwards now has a dose of radioactive, bullshit. Like, fuck you, doctors, for saying something so absolutely ludicrous. You see what I'm saying? Like, I'm getting heated. But that's just bogus information. So, of course, I don't like this information that they told me. So, and I found this out yesterday. And they asked, why did, protocol change? And they said, because, people just don't have time. People don't have time for cancer. One, and they have to work still. And insurance companies don't want to pay. And the hospitals just don't have enough room for people. Like I said, I live about 35 miles outside Chicago, Illinois. We have a crap ton of hospitals. And we have a lot of resources here. It's not like I live in like a rural community that really doesn't have the resources in order to house people who are sick or cancer, or, you know what I mean? Like, this is a very metropolitan area. And so I called up Cancer Center of America, and not because I'm trying to be dramatic, but I'm very concerned of exposing people, like, to my radiation. And were they helpful? They gave me a lot of information that I've already known, and they also agreed that most cases, people are housed separately within a wing of the hospital and you're in isolation. But now their oncologist nurse is supposed to give me a call sometime, like Monday, and I'm supposed to talk to her or him. Great. That's fine. So I called up another hospital in my area, and I asked them the same thing, and then I got more information from that hospital that's not mine, that my endocrinologist is not affiliated with, and they told me that, basically they're sending people home now because of insurance not wanting to cover this. And I said, well, what if I call my insurance company and they say they're willing to pay for it? What if I tell you I'm willing to pay for it? Does that make a difference? And they were like, well, it's just something nowadays. It's just not commonly practiced here. So, I don't know what I'm going to do. I am feeling extremely, like, overwhelmed, and I want to make a good decision. Not only for me, but my family and anyone else that I can possibly come in contact with. And I know this is supposed to happen quick. Your body is only supposed, they say 6 weeks from your surgery is the allotted time for you not to have some kind of hormone therapy. So I'm running out of time to figure this out. I'm really running out of time. Yeah, so let me know what you guys think. And then I have noticed that lately I have been feeling really kind of just like, and I know it's just because like my hormones are going crazy, and I know it's like not really me, but I have been feeling a little bit more just mellow and like, hey man, like maybe melancholy is a good word. And I've gotten like pretty irritated with my mother lately. And I know I'm being a baby, and I'll just like quickly vent for like a minute or two longer, but we've had a lot of like fucked up things happen in our family as of lately, between me, my grandma passing away, which is my mother's mom, my friend who's no longer with us from his own depression, basically. My mom's husband is riddled, his face, I guess, is riddled with skin cancer cells and precancerous cells. Now, that's the other thing about my mom. It's almost like, I'm not saying she exaggerates, but like what she says and reality sometimes is like two different things. It can be. And she's not a liar. She just talks where it's like, let me just hear it from somebody else, because sometimes your facts are super like off. But I know he does have some, at least pre-cancer cells on his face. I know that for a fact. My grandpa, who's my grandmother's husband, my grandmother who just recently passed, he's had a lot of health issues for a really long time. I mean, he's had a lot of strokes in the past. His kidneys are failing. His heart's failing. And his like gallbladder's failing. And basically the doctors are like, well, there's just really not much you can do, because like if your heart's failing and this is failing and this is failing, you can't have surgery. And like, we're not going to put an 82-year-old on like a list for a heart transplant. That's just not what they do, you know, and they shouldn't. Like, there's younger people, and you know, he's had a great life. So, and I'm not trying to be morbid here, but I'm being honest. And he was in the hospital for I want to say like 4 or 5 days, maybe 6 days. He was in the hospital for quite some time, and just to be basically told, no, not even, he was in the hospital for 4 days. What am I talking about? And basically be just told, like, yeah, you have these problems for a long time, and, you know, maybe consider going into a nursing home, which, of course, my family is not going to do to him, but my mom is, I can't help take care of him right now, like I did with my grandma. I'm in school, I'm working, I'm doing like an internship right now. I have my own life too, and I have my own problems going on right now, and I just can't really fully commit like I had with my grandmother. As bad as that sounds, I can't, and it makes me feel bad, but it's the truth. And I know it's just my mom, and her husband helps out a lot, but, you know, the problem with having thyroid cancer is it's definitely one of those cancers where people like just kind of dismiss and say you're gonna be fine, and that's that. And I can tell you, like, when I first found out that there was a 50-50 chance that it was that what I had could be cancer, Do you know how many people tell me, like, I'll be there for you, you need anything, I'm there, you're not going to be doing this alone, I'll go with you to your doctor's appointments, and, you know, I'll help you talk to the doctors and get the answers, you know, that you need, and advocate, and whatever. I had so many people tell me that. In all my videos, if you watch them, it's really just been me. And I know, like, oh, poor baby, like, you're bitching, like, you should be lucky and thankful. But no, like, and I am, and I know that I'm an adult and I have a husband. And I know there's other priorities going on, and I'm not the center of the universe. I get that. But what's irritating to me is, like, my mom will be like, well, did you ask him this question? Well, no, Mom, I didn't ask him this question. Well, why not? And then it's like I get kind of defensive, and it's like, why? I didn't think of that question, and it's not like, you know, I was expecting to hear you have cancer, and then for my brain to automatically trigger the questions that you don't think about until, like, midnight, or, you know, the middle of the night. And so, like, when I found out that I had cancer a couple weeks ago now, like, that it was contained or whatever, and then I found out, like, a few days later, after, like, the long weekend, basically, that it was cancer and I needed to do this radiation treatment, I had told my mom. I said, you know, it's confirmed I have cancer and I have to do radiation. And we do like to go on, well, my mom goes every single year to Florida, to specifically Sanibel Island. So, for Thanksgiving. And because of, like, the hurricanes and stuff, it turns out the place that they stay at had gotten destroyed and it was going to be under, like, construction. So they offered them, this was, like, literally the week I found out that I had cancer. They offered them, and they didn't have plane tickets or anything, offered them 100% their money back. And I had told her, you know, hey, you know, I have cancer. It looks like between 2 and 3 weeks from now, I will be having radiation. She's like, well, keep me posted. You know, I want to be there for you, you know, help you out, let your dogs out, because I know it's going to be, like, hard, especially if you're going to be in isolation and you're not going to feel good, da-da-da-da-da. I'll help you out. And I said, well, just so you know, it's going to look like the week of, like, Thanksgiving, probably. If not, somewhere around there, because it's usually about, like, 2 to 3 weeks after surgery is, like, when you get the radioactive iodine. Well, my mom went ahead and just booked a hotel or her condo or whatever she likes to stay in with a different company, and took my grandpa and her husband, and they're doing that for Thanksgiving. Fine. No problem. Not mad about it. But this is the part that, like, really just hurts, I guess. And I have complained about it, and I confronted her later about it, like, as respectfully as I could, without, like, trying to make her feel bad. But I had texted her yesterday saying they were telling me I need to get a pregnancy test because I'm going to do radiation this week, like, this upcoming week. And that was on Friday. That was yesterday. And I sent her the screenshot of the voicemail, because I have the voicemail that, like, you know, reads everything out loud. Or, you know, it spells everything out loud from someone that left a voicemail. And my mom goes, well, can you move your radiation for the week I get back? And I wrote back to her and I said, I'm going to do radiation when my doctor tells me it's time to do radiation. She goes, well, I feel guilty. And I'm like, I feel guilty, she said. And it's like, and I didn't text back because I knew if I texted back, it was going to be really like, I told you weeks ago when you had the opportunity not to have went on vacation, you know. So I called her and she's like, well, you know, and she brought it up again, like, can't you move it? And I'm like, Mom, I know maybe to you this seems like a easy cancer to beat. And relatively speaking, sure, I have a 98% chance of survival. That's great. And I want you to go on vacation, and I want you to, have fun. You deserve it. But I did tell you a few weeks ago when all this went down and you had that opportunity, that window to cancel, that this was my reality, that I couldn't go with you to Sanibel this year or Thanksgiving plans because I was probably going to have radiation. She goes, yeah, but I didn't really think you were. I'm like, but this is reality for me, Mom. I'm literally, I have to do this. And I'm like, and I feel like it's kind of upsetting that you would rather have me keep cancer in my body a week or prolong it instead of me getting the treatment that my doctor finds necessary for me to have because you are on vacation. She goes, I'm not doing it. I'm not on vacation. I'm bringing your grandpa. And I'm like, Mom, yeah, going to Florida for Thanksgiving is a vacation. You don't need to spin it to be something else. I'm being real with you. I'm just shocked that, and I'm like, and furthermore, I'm not trying to hurt your feelings, but I'm just going to be really real with you. I said, when I needed you in the hospital and I needed someone to advocate for me, and when I was being pumped up with 3 different kinds of narcotics and I was having allergic reactions and I was in the hospital for the 2 nights, you were there for a couple of hours, and you were only there when it was totally convenient for you. And then when you told me you would come back, then you would say, oh yeah, I'm sorry, I fell asleep. I'm like, I know this hasn't been top priority for you, and I know Grandpa and Grandma, and I know there's been a lot going on, and I'm not blaming you for it, but it's not like you have really been there either, to support me through this either. So even because my husband had to go, I came back home, after I was in the hospital for 2 nights. I had come back home, and my mom had told me how she was going to help me clean my house, and how she was going to stay with me, for when Justin had to go back to work.